The Before Operational Stress Project is a mental health and resiliency training designed for public safety personnel, healthcare workers, and frontline workers. It was designed by Canada's leading psychologists and experts and is a tool for frontline workers to manage their operational stress. In contrast to counseling programs, where they're very much needed but are intended to be responses to operational stress injuries, BOS is designed to be taken early in the career, where participants are exposed to new tools and new coping mechanisms to manage operational stressors that they will incur as part of their work. We at CIPHER have been conducting the independent evaluation of the Before Operational Stress program, and Wayfound Mental Health Group has been delivering the training to PSP and frontline workers on the ground. So Wayfound has been engaging with different PSP organizations and inviting them to participate in the program. We've seen from the data that they're collecting that there is a lot of interest in the program, but engagement can depend on PSP sector quite heavily and can depend on the stressors that are already in place for those organizations, whether they're going to be able to take advantage of the training or not. So for example, we have more healthcare workers than firefighters engaged in the training according to Wayfound's data, but the spots that were opened up to firefighters have almost completely been filled, whereas although we have a higher total number of healthcare workers, they actually represent a fraction of the spots that were opened up for them to be able to take the training. And this can depend on industry burnout, it can depend on organizational stressors and some other variables as well. If you have back-to-back 16-hour work shifts and then have to get home to cook meals and take care of your family and then prepare for the next workday, it can be a very hard ask to then go sign up for a 2-hour training course. There is already some published research available about the BOS program. This was a study where they were evaluating participants who were going through the training in the intensive modality. So this is where you have a group of 8 to 10 peers with a clinical facilitator going through the module week by week for 8 weeks. And this study found small but statistically significant improvements in PTSD symptoms, mental health stigma, quality of life, and social support. With our current evaluation, we are also focusing more heavily on that online modality because it is so easy to distribute over a wide geographic area. And we have a chance here to compare the effects of the online modality to those previously published effects from the in-person modality as well. Resilience is often portrayed as a personal quality. Someone that is resilient can more easily adapt to stressful changes and bounce back from stressful situations. But resiliency can also be fostered in an individual by elements such as resiliency skills training or a supportive leadership environment or a supportive work environment. And it's very important for PSP to be able to have that organizational and that leadership support in order to maintain a resilience and maintain a sustainable work environment. It's more important now than ever to make sure that our leaders, our organizations, and our governments support PSP on the ground who are trying to get these trainings.